in.
Hi, my name is Dana. I'm going to be your nurse practitioner for today. I'm just going to wash my hands real quick and we'll get started.
Okay, sounds good.
Washing my hands. Okay, can you go ahead and tell me your full name and date of birth, please?
My name is Christine Shahinian. I was born on July 3, 1994.
Okay, can you tell me where we are today?
We're at the clinic.
And can you tell me what year it is?
2020.
Okay, I'm going to do a neuro exam on you today.
Okay.
I'm going to touch some parts of your body, mainly around your head and your shoulders. If you feel uncomfortable at any time, please let me know.
Okay.
So we're going to start off with cranial nerve number 2, which is the optic nerve.
Okay.
We're going to use the Snellen chart right here. I'm going to have you cover one of your eyes, your hand, and go ahead and read this line right here for me.
X00.
Okay, go ahead and cover your other eye and read this line right here for me.
00X.
Okay, very well. And now I'm going to check your eyes, pupils, to see if they are reactive to the light. Go ahead and look straight at me. Okay, so the pupils are reactive to light. Okay. And now we're gonna go to 3 cranial nerves together, all together, which is cranial nerve 3, 4, and 6, including oculomotor, trochlear, and abducens. This part of the test requires you to just follow my hand. Don't move your head or neck, just your eyes, okay? So go ahead and look straight at my finger. Okay, and now we're gonna go up. Okay. Okay, so that was cranial nerve 3, 4, and 6. And now we are going to move on to cranial nerve number 5, which is the trigeminal nerve. This part of the test will have to check for a pain sensation. I'm going to use this tool right here. It does have a sharp and soft side to it, so I'm going to have you cover your eyes. I'm going to put it around your face and you tell me if you feel a sharp or a soft sensation on your face. Okay, go ahead and cover your eyes.
Soft. Sharp.
Okay.
Sharp.
Okay, and which side of that face was it?
Right.
Okay.
Sharp. Left side. Soft. Right side.
Okay, very well. And now I am going to assess your masseter and temporalis muscles. I'm just going to have you clench your jaw, and I'm just going to see if it's symmetric on both sides. Go ahead and clench. Okay. And now I'm going to move up right here, your temporalis. Okay. So the movement is felt equally on both sides of your face. So you're able to clench, and I feel it on the bottom and top. Okay. And now we are going to move on to cranial nerve number 7, which is the facial nerve. So I'm going to have you puff your cheeks for me, and I'm just going to squeeze at your cheeks to see if it's symmetric on both sides, okay? Go ahead and puff. Okay, feels symmetric on both sides. I'm going to have you shut your eyes really tight, and I'm going to lift your eyelids to see if you're able to keep your eyes shut. Okay, very well. And now we are, just go ahead and raise your eyebrows for me together. Okay, blink your eyes, smile. Okay, so movement is symmetric on both sides of the face. So now we are going to move on to the cranial nerve number 8, which is the acoustic nerve. I'm going to grab my tuning fork right here. We are going to do a Rhine and Weber test. So what I'm going to do is smack the tuning fork on my hand. I'm going to put it behind your ear bone, and you're going to tell me when you stop feeling the sensation of the vibration, okay? And then I'm going to put it right next to your ear, and you tell me when you stop hearing the noise, okay? So here we go. So, one more time. Okay, so the air conduction was definitely longer than the bone conduction, and that's what we want to hear, okay? So now we're going to do the Weber test. I'm going to go ahead and do the same thing with the tuning fork, and I'm going to put it above your head, and you tell me if you feel the vibration or the noise equally in both ears, okay?
Oh yeah, I hear it both sides.
Okay, very well. So unilateralization is in both ears. Okay, so now we are going to move on to cranial nerve number 9 and 10, which is the glossopharyngeal and the vagus nerve.
Okay.
I'm going to ask you to open your mouth. Look up, open your mouth. I'm just going to use the light right here. Stick your tongue out. Okay, uvula is at midline. And then I'm going to check for your gag reflex, and for the purpose of this test, I'm going to use a fork. Okay. What I'm going to do is stick the fork down your, not all the way down your throat, but in your mouth, and you tell me if you feel any sort of gag reflex, okay? So go ahead and open. Okay, gag reflex is positive. Patient feels gag reflex. Okay. So now we are going to move on to cranial nerve number 11, which is the accessory nerve. This is pretty much going to check your shoulders to see if they're symmetric and able to move up and down symmetrically on both sides. So I'm going to go right behind you. Okay. Go ahead and shrug your shoulders up. Okay. Again. All right. Patient is able to move both shoulders up equally at the same time. Now I'm going to check for your neck and head movement. So I'm going to put my hand right next to your cheek, and you're going to go ahead and turn your head towards my hand. Okay. Right there. Okay. And then go ahead and do it on this side. Okay. So that was cranial nerve number 11, which was the spinal accessory motor nerve, and it was great. And now we are going to go to the last and final cranial nerve, which is cranial nerve number 12. It is the hypoglossal motor. So I'm just going to have you swallow. Okay. Go ahead and swallow. Okay, trachea looks like it's at midline, able to swallow normally. And then I'm going to ask you to just say a few words, like 5 or 6 words, like hi, hello, my name is.
Okay. Hi, hello, my name is Christine Shahinian.
Okay, very well. And then I am going to ask you to move your tongue around. Just do left and right and up and down. Okay. Okay, very well. Looks like you've completed all 12 cranial nerves. Okay. Everything looks fine. Everything is within normal limits. You're moving symmetrically. Okay. Eyes, nose, everything. It looks good. Just go ahead and follow up for your next appointment, okay?
Okay.
Thank you.
Thank you.
Bye-bye.
Bye-bye.